A colonoscopy allows the doctor to look inside of your large intestines to see if there's anything wrong, any inflamed tissue, abnormal growth, or any ulcers. They'll look to see if there's any signs of cancer in the colon and in the rectum. It also look to see if there's any causes to explain changes in your bowel habits, and also evaluate symptoms like abdominal pain and rectal bleeding and weight loss. You will be given instructions in advance that will explain how to prepare for your colonoscopy. The colon must be completely empty for it to be safe and thorough. To prepare for the procedure, you'll be on a liquid diet for 1 to 3 days before. The liquid diet needs to be clear, not have any food colorings. It can include fat-free broth, strained fruit juice. You can have water, plain coffee or tea. You could have a diet soda or Jello as long as it's not red, as long as there's no color. Thorough cleansing of your bowel is important before a colonoscopy. You'll probably take a laxative the night before the procedure. Sometimes you might be given enema. It's performed by inserting a bottle that has water and sometimes mild soap in your anus to clean out the bowels. Make sure that you inform your doctor of any medical conditions you have or any medications that you take on a normal basis, such as aspirin or any arthritis medicine, blood thinners, diabetes medicine, or vitamins that contain iron. The medical staff will also want to know if you have any heart disease, any lung disease, any medical condition that may need some extra special attention. You might also have someone take you home after the procedure is done because you won't be allowed to drive while you're sedated. For the colonoscopy, you will lie on your left side on the examining table. They'll give you some pain medication, a moderate sedative to keep you comfortable and help you relax during the exam. The doctors will monitor your vital signs, look to see if there's any signs of discomfort, and make adjustments. They'll insert a long, flexible lighted tube into your rectum and slowly guide it into your colon. The scope, it transmits an image of the inside of your colon onto a video screen so that the doctor can carefully examine the lining of your colon. The scope, it bends so that the doctor can move it around the curves of your colon. You may be asked to move and change your position sometimes so the doctor can move more easily and the scope can get a better picture of your colon. The scope blows air inside your colon and it inflates it, and that gives your doctor a better view. Normally, a lot of the patients, they won't remember the procedure once it's finished. The doctor will be able to remove most of the abnormal growth that's inside your colon, like a polyp, which is a growth in the lining of the bowel. Polyp is removed using a small tool that's passed through the scope. Most polyps are not cancerous, but they can turn into cancer later. But just by looking at it, it's not enough to tell if it is cancerous or not. They'll be sent to the lab for more testing. By identifying and removing a polyp, the colonoscopy prevents cancer from forming more likely. The doctor will remove some tissue samples and send them to the lab to see if there's any colon disease. Often the test allows for an accurate diagnosis, which allows for more better treatment without the need for any major operation. During the procedure, you might feel a mild cramping. If you take several slow, deep breaths, you can reduce the cramping. Bleeding and puncture of the colon are possible, but they're not common complications during the procedure. Altogether, it usually takes about 30 to 60 minutes to complete. The sedative and the pain medicine that's given to you should keep you from feeling any discomfort during the exam. However, you may feel some cramping or feel like you have gas after the procedure is completed, but normally within an hour it's gone. Once you have finished the operation, you have to stay at the facility for 1 to 2 hours until the sedative wears off. It's not common, it's mostly rare. Some people experience severe abdominal pain, fever, bloody bowel movements. They can feel dizzy or weak after. If you experience any of these, you need to contact your doctor immediately. Make sure to read your discharge instructions. Medications such as any blood thinners may need to be stopped for the short period of time after the colonoscopy, especially if you have a biopsy or if there were any polyps removed. Full recovery is normally by the next day. It's expected that you may return to your regular activities.